Can everybody see my screen? If you can please give me a thumbs up if you can see and hear me correctly, especially my screen. Shirley, can you see my screen? Perfect. All right. So we are going to record this meeting because there are so many people who cannot make it today, but they request that we record the meeting, so we will do so for them. And just giving you a heads up. And can you start the recording, Shirley? All right, perfect. Okay, before we start, we have to go over our disclaimers. This webinar is for educational and informational purposes only. It is not intended to serve as medical advice or diagnosis or treatment. You should not replace this guidance from your personal healthcare provider. Should you have any questions, please reach out to me. I'll be more than happy to answer all your questions. And but please, making sure that we understand the disclaimer before we dive in. All right. So this is our agenda for tonight. This is a multi-series webinar where we'll unpack a lot on gut health. Gut health is so much, there's so much information. We will not be able to complete everything in one night. So tonight we are going to talk about functional medicine. I know a lot of you might not know what functional medicine is, so I will give you my story and why I found functional medicine and how I fell in love with functional medicine. And then we'll talk about the digestive phases, um, which is the main subject for this webinar. And we'll also go over the understanding of the gut microbiome. That's where you will see how your entire body is connected to your gut lining. And also, I will share with you some best practices, and then I will take some questions towards the end. But in the meantime, if you have some question, please drop it in the chat and my team will be more than happy to answer those questions for you. And then I have a freebie for you, something that will be very helpful for you, so you can utilize right now that will be helping you with your digestion. All right. Can I go to the next slide? Perfect. This is me right here. All right, for those who do not know me, my name again is Samuel Louis Saints. I was born and raised in Haiti, and I moved to the US back in 2009. That's over a decade ago. That was before the earthquake happened in Haiti. And I used to live in Massachusetts. I recently relocated from Massachusetts to Georgia a couple of years ago with my wife. And I have been in the medical field since 2011, starting as a medical assistant, working in different settings such as emergency department. I did primary care, and I also did some inpatient mental health and cardiac unit, especially during COVID. And I earned all my nursing degree from Regis College, which is in Weston, Massachusetts. And now I run my own practice in McDonough, Georgia. I offer both in-person and virtual visits. I am a board certified nurse practitioner. I am a medical examiner, and I'm a functional medicine provider. And more importantly, I'm someone who really got really tired of people, especially women, pushing through frustrating symptoms that no one seemed to explain, which is the purpose of this webinar series. For example, I know some people complaining of abdominal discomfort, some bloating. They may have to unbutton their pants by the end of the day because they are so bloated or backed up. And some people have been trying to lose weight for so long and nothing seems to be working, no matter how healthy they eat or how hard they exercise. And I know some people, especially a lot of my patients, they are taking probiotic, magnesium, detox kombucha, and none of these are working. And so I say this is a pattern that I see a lot with my patients. So then that's one of the reasons that I became a functional medicine, because looking at all those problems, it actually is the body giving you a red flag, actually waving the red flag, saying that, hey, there is something deeper that is going on. I need some attention. And often our provider overlook that because they are so busy, which I understand totally. So right now I still work. I'm currently working at the VA Veterans Affairs as a patient safety manager. And in that role, I actually utilize the root cause analysis approach to unearth the real um, symptoms that's going on with a patient, for example. And that's where I focus more on identifying the system gaps instead of just giving another pills. And so now I am fully a functional medicine provider. And I also do traditional medicine, but at the same time, I focus more on functional medicine because it is really, it helped me deep dive to exactly what's going on to the patient rather than just focusing on the symptoms. Now, this is the difference between functional medicine and conventional medicine. So, functional medicine, like I said, it focuses on the root cause of the problem. It versus conventional, which is the traditional medicine, that's where you go to your primary care provider doing your physical, which I recommend, do your physical every year and your follow-up. But traditional medicine, they focus on the symptoms. For example, let's say if you come to your primary care provider, you say that, hey, doc, I have this acid reflux, or I have this cramp, or I'm bloated so much, I don't know what's going on. They just gonna probably ask you a few questions and then give you a pill and then say, okay, let's do a follow-up and see how you're doing. And they might give you some exercise to do or some lifestyle changes, but they're not really going deep into what is going on with you. So that's why I really fall in love and functional medicine, because a lot of my patients, one question that they always have been asking is that why am I so medication? I'm on a lot of medication. I don't know why. And I honestly understand that. And I even ask myself, like, really, like, why are they on so many medications? Because sometimes a lot of people are taking unnecessary medication. A lot of prescribed medication are really they're not supposed to be long term, but unfortunately, because the doctor is not really um, treating the root cause of the problem, then that's why they probably will continue to give you the same medication, and then you may have some relief for like a month or two, but then go right back to the medication. Right. Now we are going to talk about the gut health. So the digestive system comprised of three phases. The first one is the cephalic phases. The cephalic phase is when the you're triggered by seeing the food, by smelling the food, or just thinking about the food. This is the first phase of the digestive system. The digestive tract is very long. It starts from the mouth and down to the anus. So by just thinking about the food, seeing the food, what happened in that stage is basically you send a signal to your digestive tract by telling your gut to be ready. Okay, there are going to be food introduced. So now you need to be ready. So the gastric start producing some acid, which is really important that we'll talk about later. And then also the saliva start to multiply. You'll get multiple, like a bunch of saliva in your mouth, which is really, really important for the first phase. Because once you introduce the food in your mouth and then you start chewing the food, that itself, carbohydrate starts breaking down by um, an enzyme called amylase. It's called salivary amylase. It produces right in your mouth, and then it starts breaking down the carbs, which is really important. You want that to happen before the food even goes down to your esophagus and to your stomach. And then the second phase is the gastric phase, which is a really, really important phase. So in that phase, that's when the hydrochloric acid, which is the stomach acid, you want the stomach to be very acidic. Why? Because there are so many reasons. Number one reason is that when the stomach becomes acidic, then it activates an enzyme called pepsin. And the pepsin, what it does is start breaking down protein in your stomach. It breaks it down really well. And then the small particles will go down to your small intestine. And another role of the stomach acid, which is really important, is like basically just think about cleaning meat, for example. Like to clean the meat, you put a lot of vinegar or you season it with lime. Why? Because you are getting rid of the microbe, all those bad pathogens. So the gastric acid does the same thing too. Before the food leaves the stomach to go down to your small intestine, the gastric acid will make sure to kill all the bad pathogens, the bad bacteria, getting rid of all of them and really smash the protein so you can really start absorbing the food. And keep in mind, whenever the food is in your stomach, you're not digesting, not that you're not absorbing the food yet. It is when the food goes down to your small intestine, that's when you start absorbing the food through your body, which is the third phase. It's the intestinal phase. That is when now your small intestines continue to digest the food and now absorbing the food by taking all the good parts from the food and getting rid of the undigested food. So what happened to the undigested food is that it takes the small intestine push the undigested food down to your colon, which is the large intestine. And then when the food goes down to your large intestine, what happened is there was fermentation. So now the bad bacteria will start ferment the food, and that's when you start producing gas and you start burping. So that's the normal phase, of the digestive system. It is really important to understand how it works. That way you really have an idea when something goes wrong, what to look for, and it'll start clicking. And for those who are visual learners, this is the picture of the anatomy of the digestive system. As you can see, it starts on the mouth, and then you have the amylase, which is the enzyme that start breaking down the carbohydrate right in your mouth. And then it goes down to your esophagus. And from the esophagus, it lands to your stomach. And the stomach, you want it to be very acidic. You want the pH to go down to between 1 or 2. Very acidic. Only in your stomach, though. You don't want any other part of your body to be that acidic. And then Again, when it gets really acidic, it kills all the bad pathogen, and then it activates the pepsin, which is an enzyme that starts breaking down the protein, and you want that protein to be broken down really good. And then from your stomach, it goes down to your small intestine where it'll start absorbing the food. And then from the small intestine, it goes to your colon. It's all the undigested food goes to your colon and you start producing gas. And then eventually you will defecate. As you can see here, there are the gallbladder, the pancreas, and the liver. Food does not go through any of these organs. However, they play a crucial role in your digestive system. Really, really important. I will start with the liver. The liver, what it does during the digestive system, it releases biles. And the biles, when the biles is released from the liver, it goes to your gallbladder. I know a lot of people say that the gallbladder is useless. It is not. It is a very useful organ that really help regulate your digestive system. When the bile goes down to your gallbladder, what it does, the gallbladder stored the bile. And then when you're eating, the gallbladder will start contracting and then release the bile, and the bile will start breaking down the fat in your small intestine. Really, really important. If you do not have your gallbladder, you will have some problem with your digestive system. If you have any liver problem, you will have some problem with your digestive system. And then for your pancreas, there are multiple things that the pancreas does. You know how the stomach is very acidic and you want the stomach to be acidic, but whenever the food is passing through from the stomach to the small intestine, the pancreas release bicarbonate. Why? Because you don't want any acid to be in your small intestine. So the bicarbonate actually convert the acid to be more alkaline. So that way it protects the lining of your gut. And then there is the pancreatic enzyme that is also released in your small intestine. The pancreatic enzyme continues to break down the carbohydrate in your small intestine. And also, there is one more enzyme that is called lipase. The lipase, what it does, it works um, um, next to the bile. The bile start breaking down the fat in your stomach, and the bile emulsify the food, and then the lipase continue to break it down so you can have the good nutrient by breaking down all those fat. And I will give you a tip right there to show you the connection between your gut and your entire body. Let's say if you're not breaking down fat, maybe you don't have your gallbladder or your liver is not functioning as well, or your pancreas is not producing enough lipase to break down the fat. There are several things that can happen. One thing might be you might have some hair loss because you're not getting enough fat in your body. Remember, in your small intestine, that's where everything is being absorbed. You also might have some bone bruises. Your immune system might be unbalanced, and your mood. You may have some brain fog where you start forgetting things. You may be very fatigued. Why? Because you're not getting the right amount of nutrient that you're supposed to. That's when some people they are taking supplements, which is good, but if you really want to deep dive to the root cause of what, causing whatever problem you're going through, you have to look at it in a functional medicine lenses to, make sure that you know exactly what's going on rather than just taking medications. Now we're going to talk about the gut microbiome. So the gut microbiome is really, really important to know. So when I say gut, I'm talking about the entire digestive system, but I'm going to focus more on the stomach and the small intestine. And I know a lot of people think about when they hear gut, they just think about digestion, but it is more than a digestion. It's like your gut is like an entire ecosystem. What I mean by ecosystem is that you will see bacteria, parasites, viruses, and yeast or fungi, they all live in your gut and they coexist. And they need one another to create that balance in your gut. However, you don't want to have too much or too little of them. I give you an example for the bacteria. I know a lot of you might understand that bacteria already help with digestion. It'll help making certain vitamins like vitamin B12, vitamin K, and it's really, really good. And that's the good bacteria. But the bad bacteria, we don't want to have too much of the bad bacteria, which is called overgrowth of the bad bacteria, but you want some of the bad bacteria. Why? Because that small bad bacteria or harmful bacteria that is in your gut, living in your gut peacefully, it helps train your immune system. It helps your immune system make the difference between a dangerous invader and a harmless microbe. It makes it very resilient and it's really good. It helps a lot, but you just want a little bit, not a lot. And then there's another thing that the bad bacteria does is that sometimes we have some difficult fibers or protein that we cannot digest. The bad bacteria will digest them really well for you. So you need the bad bacteria in your system. And for viruses, I know some people might think, why do I need viruses in my system? Because, virus is not always a good thing. But yes, you do need the virus. Actually, the virus plays a really important role. It's like a pest control in your gut. So what the virus says does, there is one type of virus called bacteriophages. I'm not sure if you're familiar with that. So what that does, it targets like specific bacteria, especially the harmful bacteria, the bad bacteria. So what it does, it goes into the bad bacteria and it multiplies or duplicate, and then it bursts that bad bacteria and kills it. So that's how um, it keeps the gut from having too many bad bacteria because you don't want too many bad bacteria in your system. And then the parasites, which is the uninvited guest, but some parasite really help with the immune system. It helps from preventing allergies or autoimmunity and all the good stuff. And the yeast, which is the last one, is again really important. You need the yeast to help you ferment undigested sugar when you're eating. However, if you have too much yeast, such as the candida, that can cause symptoms like sugar craving, brain fog, or even food sensitivity. For example, let's say it's like 7 p.m. and you're craving for sugar or chocolates or anything sweet, that can be due to an overgrowth of the candida, which is often overlooked by traditional providers because they're not looking at the gut like we functional medicine providers look at the gut. And then the barrier, which is really, really, really important. Everyone needs to have a healthy gut barrier. What I mean by that is like the gut is like in a simple word, it's like a security gate for the entire body. So it's like the first line of defense. You want the gut lining to be intact. When it's intact, it's like a filter. It'll let the good food, the good nutrient goes into the bloodstream so you can have your vitamins and all the good stuff, and it keeps the bad stuff, the toxins away um, from entering the bloodstream. So that's why having it really intact is really, really important because whenever there is a leaky gut or any leaky gut means whenever the gut lining is not intact, that means there's a leak there. And then let's say toxin slide right into the bloodstream. That's going to cause some inflammation. It'll cause some fatigue that cause food sensitivities and even brain fogs. So that's why it is really important that we make sure that the gut lining is really intact to prevent that from happening. And then another relation between the digestion and the nervous system. That is the parasympathetic versus sympathetic. So there are autonomic nervous system. The parasympathetic, in simple word, it means rest and digest. This is when the digestion is on. That's when you sit, you calm, and you eat. So by doing so, you actually activate the digestive juice, the saliva, the amylase, the stomach acid, everything just activate right there so you can start breaking down the food properly. But if you eat during the sympathetic um, phase, which is the fight or flight, that is, I know everybody's busy. This is America. We are all busy. But you have to make sure that you prevent that from happening because whenever you're busy or you're stressed or you're doing multiple things at a time, you're not sitting to eat, your digestion is actually shut off. And when it shut off, what it happens, it slows the gut motility. Everything starts to slow down, and then you're not digesting the food like the way you're supposed to. So you're missing on a lot of nutrient, vitamins, and actually by slowing down your gut motility, you allow the bad bacteria to multiply. And when you let that happen, a lot of things may happen. There is something called small intestinal bowel overgrowth bacteria. It's called SIBO. There is the leaky gut that we just talked about. There's even infection can happen whenever you do not digest the food well. Then you will start maybe having some bloating. You may be constipated. Then you're probably going to start taking some laxative or stool softener or anything to help relieve with the symptoms. But if you continue to eat during the fight or flight phase, you only gonna get worse, or you might get better today, and then tomorrow or a couple days later, you'll get right back to the same phase. So it's really important when you eat to eat in a rest and digest phase, which is the parasympathetic phase. And this is some digestion best practice that is actually very, very helpful. I assure you, this is more helpful than taking pills. 100% very more helpful than taking pills. The first one is prepare your body, stay calm, relax, take a deep breath. That's when you enter the rest and digest mode, which is the parasympathetic mode. You need that so you can activate your digestion, so you can really break down the food. Because remember, when you're not getting the nutrient, whenever there is one part of your digestive system stop working or is not working optimally, it'll affect the entire body. Fatigue, the immune system will be imbalanced, and you'll be bloated and have all those problems. Then you start asking yourself why. It's by starting with those simple tasks. The prepare your body, really important. The second one is practice mindful eating. That is another one that I spoke earlier is to take your time, smell the food. It might sound very okay, that's simple, you smell the food. but it's really, really important for your digestive system. You smell the food, you you take your time so you can activate the saliva and the stomach acid. For some people who pray, I'll say that's some good practice. You before you eat, you sit and then you pray. That will give your digestive system enough time to activate, and then when you start eating, it'll make a huge difference. I assure you that will make a huge, huge difference versus keep taking pills. Unless you're just used to take pills, but I I don't recommend that. And the next one is to eat until you are satisfied. Sometimes the food is so good and we want to continue eating. We're like, man, this food is really good, but really listen to your gut. Listen to your gut. Whenever you're full, don't force it. Just give yourself a break because you need that space, which is the last one, the space to space your meals in order for your digestion to process. Remember, it may take 2 to 3 hours for the digestion to really, really process because it's really long. You start from the mouth down to your esophagus. It has to go to your stomach. It has to break down. All those enzymes has to be activated and then go right down to your small intestine. See, like it goes to multiple routes and every single part needs to be active and you need to give it some time, which is the last one, number four. I recommend all of you do this for at least four digestion best practice. And I'm adding for the fourth one, I'm adding this. If you can eat every 3 to 4 hours, that will be great. Why? Because there is something that I'm going to talk about in the next webinar. It's called migrating motor complex, MMC wave. What it does, it like a housekeeping for your body. So let's say you eat right now, and then 90 minutes later, the MMC waves start cleaning up all the undigested food right through your digestive tract down to your colon so you can defecate it. So you need your digestive tract to be very clean between meals. That way you don't have any bacteria overgrowth, any viruses overgrowth, or any candida overgrowth. The MMC work is really important. That's why when you eat every 3 hours, 3 to 4 hours, then you give that MMC with time to do the cleaning in your digestive tract. That MMC wave will stop whenever you introduce food in your stomach. Whenever you start swallowing food, the MMC wave will stop. So if you keep interrupting the MMC wave, it'll affect your digestive system. So very important to eat every 3 to 4 hours. And then also before you go to bed, try to eat 3 hours before, at least 3 hours before, because you don't want to just eat and then go right to bed or go to bed in an hour. And just go for a walk after you're done eating make a huge difference. It helps big time with your digestion. You're done eating, you go for a small walk, and then you'll feel a lot better. And also, if you can give your digestive system at least 12 hours of rest. So if tonight, 7 p.m. was the last time you introduced food in your mouth, may the next time you will eat again be the next day at 7 in the morning. At least to give yourself 12 hours of a good digestive break. It'll make a huge difference. I'm telling you, it makes a huge difference over taking pills. All right. Well, this concludes the first part of the webinar. I thank you all for taking your time out of your busy day. I know it's the evening. You probably had a long day at work and you come here and sparing your time with me, and I appreciate that. So the next webinar will be Thursday, April the 24th. This is when we will go deeper into why people feel bloated even when they eat clean. Because I know a lot of people, they eat healthy, they eat their vegetable, fruit, they exercise, and they are still bloated. There are several reasons that may cause that, and we're going to really deep dive into that next time. And again, I want to thank you. If you have any question, I don't know if anyone drop any questions in the chat. No. If you have any question, I will be more than happy to answer them. And also, we have a freebie for you, something that will help you with your digestion, and it's something that's working right now, and that is a generic best practice, but I understand sometimes you may have something that will need a personalized care. At the same time, we have some best practice, which is fundamental that people often ignore, but we always encourage that. This is what I've been doing now to all my patients, making sure that we start from the foundation. You start doing the small things that will make a huge difference. And then from there, we will start deep diving into what else is going on by either making a long, health history and also ordering some functional medicine lab, which is advanced labs. Now, I am going to leave the floor to any one of you who have any question that I can help or assist with. Or you can drop it in the chat if you like. If you're shy, you don't want to speak. How do you know if your gut line is intact? Well, I will start by saying that if you are not bloated, that is a good way of knowing that it is intact. And if you don't feel very tired or exhausted, and sometimes you either cannot stay awake during the day or at night you cannot sleep, that's that's how it may click. Maybe something is wrong with your gut, or maybe you're craving for food or sweet especially. And sometimes if you have any infection or anything, so basically it's anything that I talk about. If you don't have any of this and you are moving your bowel daily, I'm gonna say again, you are moving your bowel daily. I know this is something that I'm going to talk deeper about, and I hope that you can make this one. This will be the third webinar. You have to move your bowel daily. If you're not moving your bowel daily, it is a problem. Yes, it is. Every other day is not normal. It really is not normal. I thought it was normal, but it really is not normal. So it's basically by feeling energized, by really feeling energized. And that's one clue that will let you know that your digestive tract is, your gut lining is really intact. Because once that gut lining is not intact and the toxins start going into your bloodstream, you're going to feel it. It can be infection. It can be even food sensitivity. It can be a lot of other symptoms. How? Well, there are several things besides everything that I talk about, which is really the mindful eating that helps big time. Because if you are not mindful while you eat, then you're going to slow down your digestive system. And then if you slow it down, what's going to happen is that the bacteria will start overgrowing. And then also, you want to have the right amount of stomach acid right in your stomach, the hydrochloric acid. So again, when the hydrochloric acid is really, really acidic, the first thing it'll do, it'll decrease the pH and then activate the pepsin. Then the pepsin will start breaking down the fat. So if that's not happening, then the bacteria will start overgrowing, because remember, the acid also kills the bad bacteria. So when in your stomach, the bad bacteria, they like, okay, they're still alive, or they're like, okay, so the stomach is not really that acidic. So, I'm going to wait until I go down to the small intestine. And when those bad bacteria go down to your small intestine, they start ferment the food. Fermentation is basically breaking down the food, non-oxygen. So when that happens, that's when you get bloated. So in your small intestine, when the bad bacteria didn't get killed in your stomach and it goes down to your small intestine and it starts ferment the food, now you're gonna feel bloated, you're gonna be very gassy. Why? Because in your small intestine, you do not want those bad bacteria to even get there. And if they get there, you want them out, down to your colon, which is the large intestine. That's where you want those bad bacteria to start their fermentation, the burping, the farting, excuse my language. But if it happens in your small intestine, you will definitely get bloated. You will absolutely get bloated. And also, if you have candida overgrowth, remember, you have small yeast in your gut microbiome. But if they are overgrown, they will start, giving you like some bloating symptoms, constipation, and all those symptoms. So by making sure that you follow those very simple steps will make a huge difference. But sometimes it can be more than that, which I understand. It can be you may not be producing enough acid in your stomach, or you may have some overproduction of acid in your stomach. With that problem, as a functional medicine provider, I will need to do a deeper dive by going through your past medical history and also order some advanced functional labs, not the regular lab that your primary care provider order for you. This lab, we call them simple blood lab. They are really important. Don't get me wrong, they are very important. But to really deep dive into what's going on, to get to the root cause of the problem, you need advanced functional lab. So those advanced functional lab, they have multiple markers that will really point me to the direction. This is what's going on. That's why. This is why. It's like functional medicine asks why. In traditional medicine, we I call it band-aid fixes. It's like I give you a pill so you can feel better. But the functional medicine, I'm gonna ask why. I'm gonna ask you more questions. I'm gonna hold you more accountable. I'm gonna stay more connected with you. It's we're gonna work as a team, and you're gonna have to be honest with me, answer all the questions that I ask you, and tell me exactly what is going on, so I can know exactly which advanced test to order, so I know exactly what we need to tackle in order to solve your problem. It is very personalized. It is not a one size fits all solution. It's very personal. Like, everybody will have their own problem, and you will need your own personalized care plan to really, identify your problem. Anything else?
Question. So eating every 12 hours, every 4 hours through the day should help.
Every 4 hours a day? Yes, but what I want to say is that you have to make sure you don't have any medical history that will interfere with that, such as diabetes. If you're diabetic and you need to eat more often than that, absolutely. We have to weigh the good versus the bad. So that's why it will be better for me to know you. What I mean by you is your health history, to have a bigger picture of who you are and your entire organ system, so I can tell you exactly if this will be best for you. But in general, as best practice, yes, eating every 3 to 4 hours is help really, really good, because when you eat, the MMC wave, which is the migrating motor complex, is stopped. It lets you eat, and then after you're done eating, believe it or not, your digestive system will be dirty. Just think of it like that. It'll be dirty. There'll be undigested food staying, in your stomach lining, and you want to get rid of that. It's like basically having a party. Consider that having a party. You're having a party at your house. That's when you're eating, having a nice party, and then after the party, then you will come as the cleaner, making sure that you clean the house, taking all the undigested food, because those undigested food, if you leave them, they will start messing up with your microbiome, which will cause dysbiosis, which is the imbalance of your microbiome. So yes, every 3 to 4 hours, it is a very good practice. And then when I say give yourself 12 hours um, before you eat, is by basically giving your digestive system a break. We all need a break. Your body need a break. Your digestive system need a break, because your digestive system is it's long. It starts from the mouth down to the anus is really long. So when it's working, it's working. I'll give you another tip. So do you do you realize sometimes after you eat, you might feel very sleepy, or feel a bit tired? Why? Because during the digestion, blood supply goes down to your digestive tract. You know why? Because it needs a lot of oxygen to move everything from top to bottom, making sure everything goes right. So more blood goes down to your digestive tract, and then less blood goes to your brain. That can be one of the reasons why people feel sometimes they get tired. That is one of the million reason. Another reason might be if you're diabetic, doing that movement in your digestive system, your your insulin will, when you eat, whenever you have sugar into the sugar in your system, insulin will go down to regulate the sugar. Sometimes it can be not as optimal, and that can cause you getting drowsy sometimes or sleepy after eating. And another tip I want to give you is that whenever you're eating, don't drink water while you're eating. Like you eat, you're drinking water. No, why? Because when you drink water while you're eating, you're disturbing the stomach acid, and you do not want to disturb that. Really, really important.
For a 3-year-old, maybe constipated. Um, they've been constipated since 4 months old, and it's just getting worse. Any thoughts about that?
I am a I'm an adult and gerontology nurse practitioner. So my care start at age 16 and above. So from 16 years old to 100 and plus, this is my specialty. I am not specialized in pediatry, unfortunately. But what I can do, I will reach back to you, because I have a lot of colleagues. A lot of them, they specialize in pediatric. I actually know a lot of them, some of them in Massachusetts and some of them in Georgia. I will ask them that question for you. Who is that?
Sorry.
Okay, yes, I will ask that question for you and make sure you get that answer. But from my um, expertise, this is out of my scope of practice. That's all. All right. Okay. Well, thank you guys. We are going to drop the freebie, so you can take it and start using it right now. It'll help big time with your digestion. Now that you understand how the digestive system works. The next one, we're gonna go straight to the problems. It's gonna be all problems moving forward. So the next one, again, is Thursday, April 24th at 7 p.m. the same time. So we are trying to keep the 7 p.m. I know some people, a lot of people, they have kids, which I really understand. And so I'm trying to keep that 7 p.m. and see if we can get as many people as possible. If not, if another time works best, then I may have to change it. But right now, we're going to keep it at 7 p.m. But we are recording it as well for those who cannot make it. So, right, the freebie is dropped. Perfect. You got the freebie. Thank you very much. And I will see you guys Thursday, April 24th. And if you have any questions and or any further questions, please feel free to reach out to me. And Shirley, you can drop the information how you can reach out to me if you have any particular question, because I understand this is general information, but if you want to have a personalized opinion about your own problem, I am more than happy to assist you with that. But hey, this is what I do now is educate people, make sure that everybody understand what is going on in their body system and making sure as well whenever something is going on, if you're fatigued, if you have any problem, start thinking about the gut because everything starts from the gut. Even if you ignore the gut, you go all around, you're just gonna treat the symptoms. The symptoms, yes, you feel better today, then you get feel the same tomorrow. So start thinking about the gut because the gut is really, really important and it keeps your body well balanced. And again, you're not broken, you're just unbalanced. What you need is someone who listens to you, who create a personalized care that is tailored to your personal needs, your specific needs, not a one size fits all solution. Thank you again. Um, we will see you next week, and I'm excited to deep dive into the bloating, and especially for those who've been working out very hard and eating very well. Keep eating well, keep working out, not too hard though, as tolerated. But if you don't really solve the root cause of what's causing you to bloat, then you will still continue to feel the same. And I'm here to make you feel well again because you deserve to feel well. Thank you very much.